I'm Trishala Lakhani. I'm a television presenter and broadcaster from London, and I'm also a dentist. The delegates are in for a real treat. Elizabeth is amazing. She's an awesome journalist, author, a podcaster. She hosts the incredible podcast, How to Fail. And what delegates can really take away from this session is how to overcome failure and use it to your advantage. Whether you've experienced failure before or you'll experience it in the future, it's really important to use this in a productive way. So I think the delegates can lead with some real practical tips of how to overcome this. I am so excited to interview Elizabeth. As a broadcaster myself and as a female, she's someone I've always looked up to. She's accomplished so much. She's so real, raw and authentic. So I'm so excited to be chatting to her. What excites me the most about this fireside chat is to really be able to pick Elizabeth's brain on her journey and her career. She's overcome so much personally, professionally, so it'd be really good to know the failures she's overcome, how she's overcome them to kind of create this incredible brand and incredible career. Failures and dentistry go hand in hand, and any dentist can tell you sometimes when you're even treating patients clinically, things don't always go to plan, whether it's a root canal failing or nerves in teeth dying, or whether kind of there are bigger problems if you're running a practice, whether it be staffing issues or financial struggles or being able to balance your personal and professional life. Complications and hurdles are always in dentistry, so learning how to overcome these failures and not using that as like a barrier to success is really important. So I experience failure all the time on a weekly basis. Not every idea I have is going to be an award-winning documentary idea. So it really took time for me to understand that rejection is just redirection. And I always think that if you work hard and if you persist and you kind of have that motivation, your time will come. It's not really, it won't happen. It's just, when will it happen? Like, I think back to my early kind of university years, I always wanted my own radio show. It didn't happen then, but last year I got the opportunity to host my own radio show for the BBC, and I'm now doing that. And that's just one example of, it's really about timing. So sometimes I feel if it's not the right time now, the right time will come. One thing that people kind of make a mistake on, it's not really a mistake, it's we always strive for perfection. And truly, not everything in dentistry is perfect. If you are starting out, we do see a lot of people editing photos to make themselves look perfect, and that pressure to be perfect. Sometimes that authenticity is what really sells yourself and really gains that trust with yourself, between yourself and the audience. And human connection is at the center of it. Patients don't always care about what a posterior tooth looks like, how many cusps there are, how many fissures there are. They want to be able to trust you as a clinician. So I think maybe focusing more on the human connection, and that also sometimes gets missed, and we're really striving for just that perfect clinical kind of smile. I think having my why at the focus and the center of why I do everything really allows me to be credible in both worlds. Whether it's dentistry, my why is I do it because I want to provide the best care for my patients. Why do I do broadcasting and present documentaries? My why is I want to entertain my audience. I want them to feel escapism from the real world and feel entertained. And I think having that why really keeps me grounded and centered. It allows me to make the right decisions, which allow me to be credible as a clinician and allow me to be credible as a broadcaster. I completely empathise with somebody who doesn't just want to do clinical dentistry and doesn't really know how to explore another route, because I'm very lucky that I have now got a really nice balance of being a clinical dentist, which I absolutely love, and being a broadcaster, which I actually love. But I think sometimes you need to really have that self-belief that you don't just have to do one thing or fit one hat and fit one box. I think sometimes our own self-limiting beliefs don't allow us to do other things. And I remember speaking to somebody at the BBC actually who was quite senior, and I had so many ideas that I was explaining to her, and I said, well, who would you see presenting this? She said, why not you? And from that, it made me realise that we can actually do anything. We're not just dentists. So if you do want to have another career and you do want to step outside the box, you can take the action to do so. And one thing I will say is nothing changes if nothing changes. So if you do have that within you to do something else, then make sure you take the action to do so. Absolutely. And I actually think I'm failing more the older I get, which is kind of crazy. I think a lot of dentists can relate that academically we haven't failed very much because we've done our GCSEs, done our A-levels, got into dental school. So when I entered the world of broadcasting, oh my God, I didn't even know what I was getting myself into because there's no handbook of how to be a television presenter. With dentistry, you know what you need to do to get to where you want to be. But with television presenting, you're competing with Love Island stars, reality stars, actors, models, journalists, writers, so many other people. So I had faced a lot of kind of hurdles and a lot of things that I wasn't expecting. But luckily, I've had a lot of people that have believed in me, gave me so many incredible opportunities. But failure has definitely been something that has been more prominent, I guess, with my career and as time has gone on. But for me, failure isn't necessarily a negative thing. It's something you need to go through to grow, whether it's as a clinician or as a broadcaster. So I don't see failure as something negative. I see it as something that is a powerful tool in how we grow. It's so important because we live in a digital age where everything is on social media, and it's great that we do get to connect through social media, but there really isn't one event for our profession where we can meet other people, share our experiences, share our stories, share the latest courses, materials, and all these other things that sometimes we don't get to do on social media. So events like this are crucial. I'm looking forward to seeing all my colleagues, which goes without saying, but I think we've got something new, which is kind of a podcast setup where we have a lot of young dentists that are going to be on our podcast and exploring and going through their experiences, their difficulties, and I'm hosting a few sessions myself. So I think for me, that's one thing I'm definitely looking forward to.